Hello, this is my speech on cerebral palsy. Here's my audience. Um, we have, we have 5 people.
Matt, smile.
And I will go ahead and start. Have you ever imagined what it would be like to not have full or no usage of your limbs? This is what victims of cerebral palsy deal with every day. Nearly 10,000 babies are diagnosed with some form of cerebral palsy every year in the United States alone, and there are currently 764,000 adults and children nationally, according to the Cerebral Palsy Organization. Now I will define what cerebral palsy is by the Merriam-Webster's Medical Desk Reference Dictionary's definition. Cerebral palsy is a disability resulting from the damage of the brain before, during, or shortly after birth, and is outwardly manifested by incoordination of the muscles and speech disturbances. There are 3 types of cerebral palsy. The first is ataxic, and it is characterized by a poor balance and difficulty in movement. People with ataxic cerebral palsy have a lot of trouble performing everyday tasks because it's difficult for them to make their muscles move the way they want to and pick up the objects like they want to, their hands might shake. So it's it's really hard for them to do things, and this is the least common form of cerebral palsy. Athetoid cerebral palsy is the 3rd type, and it is also called dyskinetic cerebral palsy, and it is characterized by involuntary muscle movements. The movements can be rapid or slow, or a combination of both, and it's also difficult for them to speak or swallow. And the last type is spastic cerebral palsy, and it is characterized by extremely stiff muscles. It's the type that I have, and it causes your muscles to become abnormally toned, they're hypertoned, which leads them to be tight, and that's the reason when I was about 2.5 years old, I had to have a tendon lengthening surgery to release the tendon and make it so it didn't hold the muscles in the back of my leg as tight as they were. Spastic cerebral palsy is also, I forgot to mention that spastic cerebral palsy is the most common form of the cerebral palsy having population. Spastic cerebral palsy makes up 80%. So, and there's also 3 categories of spastic cerebral palsy. And the first is diplegia, also called diaparesis, and it can affect either both arms or both legs. It's more common for it to affect the legs, and difficulty walking is common. If you meet a person with diplegia, you may notice that they do what's called scissoring, which is where their knees kind of have trouble bending, or they just kind of make short little jerky movements. And hemiplegia is the 2nd type, or it's also called hemiparesis, and that is the type that I have. only one side of the body is affected, either left or right. It can be either the lower or upper extremities, but it's more common for the arms and hands to be affected the most. Like, that's what I've noticed with my own cerebral palsy, is that I notice it more in my hand, but when you think about it, you do a lot more with your hands than you do with your feet. Like, your hand, like, it requires a lot more. You focus on your hand, like, a lot more. Like, you use it a lot more. Like, you think about it a lot more. So that. And now I will move on to the signs and symptoms of cerebral palsy. Cerebral palsy is caused, like all types of cerebral palsy are caused by brain damage. It's not a progressive disorder, meaning that it doesn't, the brain damage itself doesn't get worse over time. You know, it was a one-time thing, it happened, but the brain damage, like, can affect, like, other parts of the body. Well, it does, and this effect often increases over time. Like, muscles stiffen and tighten, like the joints become disjointed, and like it changes the bone structure. Like, it changes the bone structure, and that's why my left foot, like, it curves in like this, is because the muscles are pulling the bones in directions that they aren't supposed to go. And some people have to have surgery to correct those joints. And the signs of cerebral palsy, like, cerebral palsy is usually diagnosed, like, right around when the child starts to crawl or walk. Like, you notice that when they don't meet the developmental milestones that they're supposed to. For example, stiffness or floppiness is a sign in babies 6 months of age or younger. So is overextension of the back and neck. Like, they'll lean back like this, like they're trying to push away from you. And another sign is, like, difficulty using their hands once they turn 6 months, and, like, they have trouble bringing their hands to their mouth. That would be one sign. Another is, like, crawling lopsidedly, like, just kind of, like, using one side of their body and just, like, dragging the other side along with them. Scooting around on bottom is also, like, a sign. Like, instead of crawling, like, the child will just, like, scoot around on their bottom. And not walking after age 15 months is also a sign. They also mentioned something about speaking. Like, cerebral palsy, depending on the extent of the brain damage, can affect your speech as well, like muscles in your mouth and different things, like your vocal cords. It can affect those. Now I'll move on to the symptoms of cerebral palsy. Well, obviously you would have your limbs would be rigid due to the stiff muscles, and you would have difficulty walking, moving in general. Over half with people with cerebral palsy have some sort of intellectual impairment. Like, once again, it depends on where it's at. The closer it is to the frontal lobes where all cognition takes place, the more likely you are to have that. Speech impediments, because it can affect the muscles in here. That's also a very common symptom. And difficulty with fine motor skills, like picking up things, like buttoning things, getting yourself ready, like all those are harder to do because cerebral palsy affects your fine motor skills. It affects both your gross and fine, but you really notice the fine motor skills being affected. And seizures, a lot of people with cerebral palsy have seizures, and a lot of them take medication to help with that, anti-epileptics. Urinary incontinence is also something that can show up in people with cerebral palsy, as are psychiatric conditions, because it, like the brain damage like I said, it affects all parts of the brain. It affects all areas of your body, and just changing the structure of the brain can set you up for things like that. The symptoms that I experience, like mine is a mild form, so really the only ones that I notice too much, I really notice are the tightness in the limbs and the loss of some of my fine motor skills. Like with this hand, like I can pick things up, and that's about it. Before I move on to the risk factors and causes of cerebral palsy, I will go ahead and show you this visual too, these two visuals to reinforce what I talked about. I'll show one at a time. This is like a diagram. It's kind of hard to read, so I'll read it to you. This is a diagram of the different types of cerebral palsy, and it shows the different areas that the body affects. Like, see, diplegia usually affects the legs, and this red part here is where it's most affected, and then the yellow part up here is where it's least affected, and the completely white part, like, that's not affected at all. Hemiplegia, the arms and legs are the most affected, and it's on one side of the body, either right or left. Like, as you can see, it can affect some of the trunk. And quadriplegia, this is the most severe kind. It affects all four limbs on both sides of the body. And I'll just go ahead and show you so you can see it.
Yeah, sure.
And so you can see it. I'll slide it closer. And I'll show you the second one now, which is, it shows the, I exited out of that accidentally, but that was a diagram that showed you, it showed you like what areas of the brain were affected. Hold on a sec, I'll try to open it up again. Okay, here we go. The cerebrum, try to turn it so you all can see. I guess that would work better.
Yeah,
sorry.
That's good.
The cerebrum is where the damage occurs, like to cause cerebral palsy. And then this diagram, it shows you the cerebrum is like this whole area right here. And it shows you like the type of cerebral palsy, like the different types. They're caused by the damage, the damage for each is located in like a different part of the brain. Like ataxic cerebral palsy is like the damage is localized back here, on top, like the spastic, like right there, like that's where if the damage is right there, it usually means that you have spastic cerebral palsy, and athetoid is like right up here, right near the frontal lobes. Okay. And now I will talk about the risk factors for cerebral palsy and also the causes of it. Cerebral palsy is caused primarily by trauma during the birthing process, as I mentioned earlier. During the development of the fetus, at one time they thought that it was caused by a trauma during the birthing process, but the new evidence has shown that that is false. Babies who are born prematurely, or they're born as part of a set of twins, triplets, or so on, they're more likely to have at least one child with cerebral palsy. And infections are also a cause of the condition. infections during pregnancy, such as rubella or I think mono was another one. But any kind of infection during pregnancy can put the child at risk for a disorder such as cerebral palsy. And in very rare cases, like very young babies, like if they get a infection like meningitis, they can develop cerebral palsy after birth. And cerebral palsy is more common in males than it is in females. Treatment and prognosis for patients with cerebral palsy. There is no known cure for the disorder because there is no method of repairing the brain damage that it is a result of. Treatment focuses on management and minimization of the impairment. Like they can't cure it, but they try to make it so you can have you can use your limbs as much as possible and have the best quality of life possible. Like surgery is one method of treatment. Like they'll try to lengthen the muscles so that they aren't so tight, or lengthen the tendons so that the muscles aren't so tight. And physical therapy is used to maintain the usage that you already have and improve what's there. Sorry. And orthopedic devices such as braces and assistive devices such as crutches, walkers, and wheelchairs are used to facilitate mobility. I wear an ankle brace on my foot so that it keeps it from rolling. That's my assistive device. And most people with spastic hemiplegia, as I have, are able to walk. The prognosis for people with spastic cerebral palsy is generally pretty good. And patients with cerebral palsy live just as long as those who do not have it. And once again, it depends on the severity of the condition. Like people with quadriplegia usually aren't able to take care of themselves or do anything for themselves, and they normally have a lot more problems than generally those with the more milder forms. So they tend to live not quite as long. That's where you see the decreased life expectancy. Patients who are affected on both sides and all four limbs have, well, I already mentioned that, and epilepsy is common in the people who have this form of cerebral palsy. In summary, cerebral palsy is a neurological disorder that affects movement, coordination, and balance. Is caused by brain damage. It is divided into three types: athetoid, ataxic, and spastic. Spastic cerebral palsy is categorized based on the side of the body and limbs affected. It is not curable and can only be managed through physical therapy, drugs, assistive devices, orthopedics, and surgery. I'm happy that my instructor gave me the assignment of a informative speech because it led me to look up information about my condition that was new to me. I had not previously known that trauma during birth was the cause of cerebral palsy, or was not a cause of cerebral palsy.
It can be.
It can be.
It doesn't say that it's absolutely not. And does it show up on an x-ray what part of your brain?
Yes, that's one of the diagnostic studies they do. They do imaging studies, and
that's what you had done at Blanks Children's Hospital, and it didn't show up anything.
There's different types of testing they can do. There's
different degrees of cerebral palsy.
Right.
Each case is different.
So thank you for listening to my speech.
It's very good, April.
Yes.
Good.
Very good.